Canker sores, also known as Aphthous ulcers, are small, painful lesions that develop inside the mouth. These sores appear on the soft tissues, including the inner lips, cheeks, tongue, and the base of the gums. When you get a canker sore, you'll typically notice a small, round, or oval-shaped ulcer with a white or yellow center and a red border. These sores can vary in size, but they're usually pretty small, about 1 to 4 millimeters in diameter. However, in some cases, they can be larger and more severe. It's important to distinguish canker sores from cold sores, as they're often confused with one another. While both can be uncomfortable, they're quite different in nature. Cold sores, also called fever blisters, are caused by the herpes simplex virus and are highly contagious. They are fluid-filled blisters that typically appear on the lips, around the mouth, and occasionally inside the mouth. Canker sores, on the other hand, only occur inside the mouth and aren't caused by a virus. Types of canker sores. There are 3 main types of canker sores. Number 1. Minor canker sores. These are the most common type. They're small, oval-shaped, and heal within a week or 2 without leaving any scars. Number 2. Major canker sores. These are larger and deeper than minor canker sores. They're usually round with defined borders, but they can have irregular edges when very large. Major canker sores can be extremely painful and may take several weeks to heal, often leaving a scar. Number 3. Herpetiform canker sores. These are uncommon and usually develop later in life. They're characterized by clusters of dozens of tiny lesions that sometimes merge into one large ulcer. Despite their name, they're not caused by herpes virus infections. Causes of canker sores. The exact cause of canker sores isn't fully understood, but several factors seem to contribute to their development. Stress is a big one. Many people find that they get canker sores during particularly stressful periods in their lives. Some people also develop canker sores from using toothpaste or mouthwash containing sodium lauryl sulfate. Minor injuries to the inside of your mouth can also lead to canker sores. This could happen from accidentally biting your cheek, brushing too vigorously, or even from dental work. Hormonal changes can also trigger canker sores in some people, which is why some women experience outbreaks during certain phases of their menstrual cycle. Additionally, a weakened immune system can make you more susceptible to canker sores. Your diet can also play a role. Some people develop canker sores after eating certain foods, particularly acidic or spicy foods. Citrus fruits, tomatoes, and pineapples are common culprits. Nutritional deficiencies, especially in vitamin B12, zinc, folic acid, or iron, have been linked to canker sore outbreaks. If you're not getting enough of these nutrients in your diet, you might be more prone to developing these pesky ulcers. Certain medical conditions, such as celiac disease, Crohn's disease, or ulcerative colitis, are also associated with an increased risk of canker sores. Symptoms of canker sores. When it comes to symptoms, the most obvious sign of a canker sore is the appearance of the sore itself. But before the sore becomes visible, you might experience a tingling or burning sensation in the area where the sore is about to develop. This can happen a day or 2 before the sore appears. Once the canker sore forms, you'll likely feel pain or discomfort, especially when eating or drinking. The level of pain can vary depending on the size and location of the sore. Minor canker sores might be mildly irritating, while major canker sores can cause significant pain that makes it difficult to eat or speak. The pain is often described as a sharp or burning sensation, which can be exacerbated by eating acidic or spicy foods. Some people also experience increased sensitivity to hot or cold temperatures when they have a canker sore. In addition to pain, you might notice some swelling around the sore. In severe cases, particularly with major canker sores, you might even develop a fever or feel generally unwell. However, this is relatively uncommon. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of canker sores. Diagnosing canker sores is usually straightforward. In most cases, your doctor or dentist can identify a canker sore simply by looking at it. They'll examine the sore and ask about your symptoms and medical history. They might also ask about your diet, stress levels, and any recent injuries to your mouth. If you have frequent or severe canker sores, your healthcare provider might recommend some tests to check for underlying health conditions or nutritional deficiencies. This could include blood tests to check for anemia, vitamin B12 deficiency, or other health issues. In rare cases, if the sores are particularly severe or don't respond to treatment, a biopsy might be needed. This involves taking a small sample of tissue from the sore to examine under a microscope. However, this is usually only necessary if there's concern that the sore might be something other than a typical canker sore. Treatment for canker sores. When it comes to treatment, the good news is that most minor canker sores will heal on their own within a week or two without any treatment. However, there are several things you can do to manage the symptoms and speed up the healing process. Over-the-counter treatments can be quite effective for managing canker sores. These include topical products containing benzocaine or lidocaine, which can help numb the area and provide pain relief. Protective pastes or gels that form a barrier over the sore can also be helpful, as they shield the sore from further irritation. Rinsing your mouth with salt water or a mixture of water and baking soda can help soothe the sore and promote healing. Some people find relief by applying a small amount of milk of magnesia directly to the sore a few times a day. For more severe or persistent canker sores, your doctor might prescribe stronger treatments. These could include prescription mouthwashes containing corticosteroids to reduce inflammation, or topical medications like fluocinolone gel or chlorhexidine gluconate mouthwash. In some cases, oral medications might be necessary. These could include steroid medications to reduce inflammation or medications that suppress or alter your immune system response. However, these are typically reserved for severe cases or for people who get frequent, hard-to-treat canker sores. Home remedies for canker sores. Many people turn to natural home remedies to soothe their canker sores and speed up healing. One popular option is honey, known for its antibacterial properties. Simply apply a small amount of raw honey directly to the sore a few times a day. Aloe vera gel is another soothing remedy. You can apply it to the sore using a cotton swab. A saltwater rinse can also help reduce inflammation and pain, so mix 1/2 teaspoon of salt in a cup of warm water and swish it around your mouth for about 30 seconds before spitting it out. Chamomile tea bags can also be used. You can steep a tea bag in hot water, let it cool, then hold it against the sore for a few minutes. Regardless of the treatment you use, it's important to maintain good oral hygiene while you have a canker sore. Brush your teeth gently to avoid irritating the sore further, and consider using a soft, bristled toothbrush. Avoid spicy, acidic, or abrasive foods that could irritate the sore, and try to eat soft, bland foods instead. While you're dealing with a canker sore, you might find it helpful to use a straw when drinking, as this can help the liquid bypass the sore. Sucking on ice chips or popsicles can also provide temporary relief. While canker sores can be annoying and uncomfortable, it's important to remember that they're generally harmless and will heal on their own. Now we want to hear from you. Do you or someone you know have canker sores? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.